Hello, everyone. Welcome back. Another live question and answer session. My name is Remus Repta. I'm a board certified plastic surgeon. Apparently, again, unshaved for another Q&A session here, so I apologize. However, let's get going. For those who are just joining us for the first time, basically the way it works is just feel free to ask questions. Here, Ella's going to read them off. She's in the background, and I will do my best to answer them. So, yeah, let's get going.
If a patient gets a bra line back lift and a tummy tuck at the same time, why do you usually start with the back?
Yeah, that's a great question. So, bra line, back lift, tummy tuck, you can theoretically probably do both, but you have to remember that if you're doing a tummy tuck and then you're flipping to the tummy, like if you're starting on your back to the tummy tuck and you flip over on the tummy to the bra line, back lift, you're going to be putting a little extra stress on the abdominal closure, right? And if you're going to spend 2 hours, 3 hours doing a bra line back lift, that's 2-3 hours of that tummy kind of being stressed out. And you have to remember that the tummy tuck surgery is a different kind of surgery than a bra line back lift. And so the tummy tuck involves a lot of dissection and, of course, a lot of liposuction and things of that nature. So the blood supply to the remaining abdominal skin in the beginning is a little bit impacted by the tummy tuck. Of course, it reestablishes itself. But that's the whole reason that one of the main reasons that a lot of people don't do patients with higher than a BMI of like 30 or 35. And that's how we've become basically how we pioneered plus size tummy tuck, is figuring out ways to do bigger patients, more liposuction, more dissection, more contouring without injuring the skin. However, the skin is still kind of traumatized in the beginning, and you don't want to then add insult to injury by stressing it out by being on your tummy for about 3 hours. So from a point of safety, maximum safety, especially if you push aggressively to get a great result with the tummy tuck, we do our bra line back lift first, and we flip over and do our tummy tuck second. And you might say, well, what's the difference? Now you're stressing out the back. Well, there's some truth to that. However, the back is a slightly different procedure. Even though you take out tissue, there's not quite as much dissection there. Plus, the back is more resilient. There's different connections, different blood supply, things of that nature. So the back, you can stress out quite a bit more and not have any wound healing issues. In fact, in the whole 18 plus years of practice, I've never had a bra line back lift like a blood supply issue. I've had a couple patients where they pop sutures and things of that nature, but that's not related to the blood supply issue.
Can you have plastic surgery if you have varicose veins?
Yep, absolutely. In fact, a lot of people do have varicose veins. And, if it's not in the area that you're working on, then it's definitely not an issue. But even if it's in the area that you're working on, it does not really impact the sustainability of that surgery in terms of getting great results and doing so safely and healing well. So whenever I do thigh lifts and liposuction to the legs and things of that nature, there's tons of varicosities there, and it's a little bit more work for me as a surgeon in there, but it doesn't really impact the final result, the healing, or the safety.
Do you make recommendations on what a patient needs, or do you go based off of what they request?
Well, in the ideal world, the patient gives it a lot of thought, does a lot of research. So they come into the consultation with a fairly good idea of what they look like, front and back. That's another benefit of doing the photos in the virtual consults. And they then prioritize on what items are most important to them. They look at the solutions for that different procedures. And so by the time we do the consultation, we have at least the patient has a good idea of what's important to them and then maybe what's less important. And so my goal is to obviously first provide the most safe environment, meaning I'm not there to do things just because I'm asked if they are unsafe or unwise. So I don't want people getting bad results. I don't want people wasting money for surgery that they don't need. So my responsibility as a professional, as our patient's plastic surgeon, is to safety. So make sure they're not making mistakes in terms of the things that they're wanting. And then second, really provide them ideas about maybe things that they didn't quite understand or didn't fully kind of comprehend, so that they can make a decision in a more educated fashion. So they might think without speaking that one procedure will take care of another area. And I think it's my responsibility to say, so we're going to do this, this is going to take care of this issue here. Just know this other area around here is going to remain the same. Are you okay with that? I'm not trying to convince you to have a second procedure, but are you okay with that part staying the same? And some people are like, yeah, I am okay. I totally understand. I'm going to come back to that later on. Or, oh, I didn't know that. Yeah, let's add the second procedure. I just made the assumption that that area was going to get better on its own.
I'm in my 60s. Can I have more than one procedure done at once?
Yeah, we've done lots of surgery patients in the 60s and 70s, and a lot of them have had multiple surgeries, multiple procedures at the same time. As long as your heart and lungs are healthy, age is just a number, just like the BMI is just a number. And it's the surgeon's responsibility to optimize safety and results for everyone. BMI, height, weight, age, things of that nature. So obviously, the most important part is safety. You want to make sure you're capable to on-the-go general anesthesia, that your surgeon should work with you on that. But we've done dozens of patients in 60s and 70s, a lot of them with multiple procedures. They've all done great.
What is the downtime usually for a tummy tuck and lipo 360?
Yeah, so tummy tuck, I include liposuction with my tummy tucks to the front part of the waist. At that point, lipo 360 of the waist would just imply that you're also getting liposuction in the back. The recovery is the same, whether you get a tummy tuck or a tummy tuck with liposuction to the back, making a liposuction 360. Bare bones minimum of 2 weeks downtime before you head back to work. I would do more than that. Now, you'll get different answers from different surgeons because the surgery is done differently, but also the aggressiveness or the thoroughness of the surgery is done differently. As you can maybe get an idea from the before and after that we posted, some of the videos of surgery, but patients with a higher BMI need more thoroughness in terms of the surgery to get those contoured hourglass kind of quote unquote snatched waist appearance. So I'm doing more work in surgery. That means your body is being exposed to more work during surgery, and therefore the downtime is probably going to be a little bit longer than maybe a 120-pound person just getting a skin removal only tummy tuck. So 2 weeks minimum for a plus size tummy tuck. I would encourage you to take a little bit longer if you can for more beyond that. 3 is even better. 4 is even better. No working out for probably 6 to 8 weeks.
I live in Sweden. How can I get in contact with you?
Absolutely. Well, message us here on Instagram if you want, but also if you go to our website, we have 2 websites, drrepta.com and plussizetommytuck.com. Those are 2 websites that we have. There's a consultation button at the top. If you hit that within the next 30 minutes or so, one of my office staff will probably answer your inquiry. Then we can establish a virtual consultation. You can certainly fly in for the in-person consult as well, but doing a virtual consult works great, especially if you're not in our town here. So that's the best way of doing that. But if you want to give us a call as well, you're welcome to do so. Our phone number is 855-377-3782. Obviously, the time difference is pretty huge, so you'll end up calling us in the middle of the night probably. Our local time here in Arizona, we're open from 8 to 4:30.
How do diabetics handle tummy tuck surgeries?
Well, it's not an issue if the diabetes is controlled, right? And so we've had stage type 1 diabetes, we've had type 2 diabetes, we've had pre-diabetics, we have definitively in the diabetic camp. And as long as you have a method to check your blood glucose and a method to reduce your blood glucose, then you're going to be just fine. So I would say maybe 10% of our patients are insulin-dependent diabetics of a variety of different types. We manage that in the operating room, and then afterwards, you'll have to double check your sugars just to make sure that you're not spiking or dropping down with your sugars. So we have a protocol in place for that. If you're diabetic, as long as it's controlled, then or at least relatively controlled, then we'll walk you through that process.
Can you get lipo and a BBL after having cancer?
Yeah, I mean, I think what you're saying is like, I've had cancer, I went through treatment, now I'm cancer free, and I want liposuction and BBL? The answer is 100% yes. In fact, I'll go one stage further than that. Well, at least one step further than that. We actually had a patient who had stage 4 cancer. She was not going to get cured, but she, especially with all the chemo and things of that nature and the stress of having the cancer, she felt like she didn't look great, and she just wanted to look and feel better for the remaining portion of her life there. And so we ended up doing a facelift, a neck lift on her with stage 4 cancer. She healed beautifully and healed great. In fact, I actually ran into her in the community, months afterwards, and she was doing great. So cancer by itself is not an issue for surgery. Yeah.
Can you explain how your pricing works?
Absolutely. Our pricing is time-based. That time to do your surgery, the surgery that you want to get to accomplish the results that you need with your body type, gets factored into the surgeon's fee, the operating fee, the anesthesia fee. So let's go through the example. Let's imagine a 5-foot tall person wanting a tummy tuck, and that 5-foot tall person is 150 pounds. Then we have a 6-foot tall person that wants a tummy tuck, and that person is 350 pounds. As you can imagine, if you're trying to get the best result with the best safety for both those patients, 5-foot tall person, smaller, less time. Taller person, heavier, more time. And the quotes will then reflect that.
Do you work in a rehab hotel for patients that come in from out of town, or would that fall upon us to find for that first month?
Yeah, we have all sorts of resources for you. We've been at it for 18 years. Most of our patients are out of state or out of the country, so we have lots of different resources. We have an overnight suite. You'll stay with us for the first night after surgery. Afterwards, you can go into an Airbnb, a hotel, a resort. There's tons of different options around us here. We have a long list of contracted nurses in the community that we've trained along the way to know what to see, look for, do, things of that nature. We can provide you with a list of those nurses. You can hire those nurses to be there for an hour or 4, or however you want long you want. You don't need to. You can just be in our overnight suite, and then you can go to a hotel or resort or Airbnb. And the way we've produced our surgeries and have our protocols in place is that you don't really need to do much. You don't need to do dressing changes. You don't need to change your garments out. Most of the time, it's just staying hydrated, maybe, shifting your garment around a little bit if it shifts a little bit too much, and then maybe emptying out your drain, but there's not much to do there. So don't feel like you need to have medical assistance to recuperate here in town. You can certainly be here with a friend or a loved one, and that should suffice.
Have you ever had to turn down a patient? Why?
I'm sure we have along the way, but we've been at it for so long. Most of the patients that come to see us have done their research, especially with all these Q&As that we do, have a great understanding of who they are at the moment, what they may want, what the solutions might be. They look at our before and after photos, our videos, our Q&As, our blogs, all the research that we've done. And by the time they see us, the vast majority of our patients know who they are, what they need, what they want. They know us, what can we provide, so they're ready to go. In the beginning of my career, obviously there was less of that. So I'm sure some of the turning down the patients maybe have occurred earlier on, because maybe we got patients that, just didn't have a great expectation, or they just weren't as educated because we hadn't been around for as long. But I would say, man, I can't remember the last time we couldn't do a patient. It has to be more than 5 or 10 years. And the reasons for that are as we've just described, but if I were to turn someone down, it would only be for one of 2 reasons, and it would primarily be for the first one: safety. If someone comes in and I'm like, I just don't think we can do this surgery safely, mostly because your heart and lungs are not good enough. It's not going to be because of the surgical part. It's going to be because that person cannot safely undergo general anesthesia, because their heart is basically barely functioning. Their lungs are barely functioning. And so the people that come to mind that I had to turn down along the way were people that were not in any shape or form ready for any kind of elective surgery. They were really on the bottom kind of edge of their system functioning. So those people really needed other type of kind of help before they could undergo any kind of elective surgery whatsoever. And then the second, of course, is potentially running into people who want a certain result, but maybe they don't have a good understanding of what it takes to get there. They want smooth contoured waist but no incisions. So obviously I can't do that. If you have a lot of loose skin, I have to make an incision. But I'm not sure if I've had to turn anyone down for at least the last 3 to 5 years.
Well, on a weight loss journey, do you need to plateau before doing any surgery?
Short answer is no. The long answer is, what does a plateau really imply? Nobody's weight is totally rock solid. First. Second is that plateau might be at different levels. So the short answer is no. The long answer is no as well. Because remember, I do a lot of liposuction with my tummy tucks, with a plus size tummy tuck. And so whatever extra volume is there, obviously I'm going to be thinning out and removing. And then it's possible that afterwards you might look at your smaller, smoother, narrower waist and be like, hey, I'm okay with in fact, I prefer my hips and thighs and buttock and arms to be at the current weight. So weight's an interesting situation. People will look in the mirror and they'll look at the weight scale and they'll conflate the two. But if they looked in the mirror and they didn't know how much they weighed and they had no loose skin and good proportions and good contour, they wouldn't care what the number on the scale would say.
If I had a tummy tuck and lipo 360 last October with a different surgeon and I'm not happy with my results, can I get lipo again?
I don't see why not. In fact, that's how I started my practice, just doing a lot of revisions. I started doing a lot of revisions because I had some fellowships right after residency of doing complicated kind of body contouring procedures and a lot of revisions. Subsequently, wrote a textbook called Atlas of Abdominoplasty. So by the time I started my practice here, basically everyone was sending all the complicated cases to me, the cases that they didn't want, the cases that they couldn't do, patients that were turned down, things of that nature. And so obviously almost all those patients had revision liposuction. So yes, the short answer is yes. If you've had tummy tuck and liposuction 360, you're not happy with your results, by all means have a consult with me. 99.9% of the time we can find solutions to improve the result.
What vitamins do you recommend on taking before surgery?
Well, we're assuming that you have a fairly normal life, meaning fairly normal diet, no abnormalities in metabolism, GI issues, absorption, things of that nature. If that's you, then you really shouldn't have much of a vitamin deficiencies. Obviously, there's a tendency to be vitamin D deficient because we wear sunblock. I'm trying to be out of the sun, things of that nature. Obviously, I'm not doing a good job of staying out of the sun myself. So I don't have specific recommendations for vitamins. In fact, if anyone has specific recommendations, like take this pre-surgical thing so you can heal better, they're not really doing you justice, because the only way to know what vitamins you may benefit from is to have a full catalog of lab work to show what your vitamin levels are. And chances are, if you live in the US and you have a relatively balanced diet without any kind of absorption issues with your GI tract, things of that nature, you probably don't have any vitamin deficiencies.
How many appointments do I need to have before getting surgery?
Well, just 2. The first one is a consultation, either in person or virtual, because you and I have to look at the things that you're concerned about and we have to figure out a plan together. I have to impart what I'm seeing and what I recommend and some of the things that I've learned, and then you have to communicate the things that are most important to you, and so you can prioritize things so you can get the best result with the least amount of financial investment at the highest safety margin. And the second meeting would be a couple of days before your surgery, just so that we can go through all the paperwork, the photos, things of that nature. But it also gives you and I a kind of a second chance to be like, okay, here's what we're doing, here's what we're gonna do, are we on the same page, right? And of course now, technically we'll have a third one in the morning before your surgery, but at that point you're that's the morning of your surgery.
Why is BMI so important when it comes to getting surgery?
Well, I think in the past there were people who look at all the data of plastic surgery and surgery in general, and they were trying to find patterns and complications. And they said, well, that's interesting. I wonder if heavier people with a higher BMI, because that was the simplest way for them to define what heavier people really implied. And is there a point where the BMI goes beyond a certain point where safety goes down? And they did something called a meta-analysis. They looked at a lot of different studies, and they saw a trend that as the BMI went up, the complication rate went up. But that doesn't really tell you hardly anything, because first of all, BMI is just height and weight. So you can be a bodybuilder, you can have 3% body fat, be in great shape, and your BMI could be 50, right? So that doesn't really say much. So the definition of heavier person, they used BMI to do that, and that wasn't really accurate. And then the meta-analysis, where they looked at all these studies and they saw this correlation of BMI and complication rate. Well, the surgeon down the road does surgery then different than the surgeon on this side of the road. And then the protocols and the policies and how you do all this stuff, those are all important. And so that's how I got my start. I just looked at all that and I said, you know what, this doesn't make any sense. We're not doing anyone any favors. We're not progressing plastic surgery. We're not progressing body contouring surgery. We're not helping patients that are heavier. We're kind of just stuck, mired in this idea, higher BMI, no surgery. So I set out on this journey to really understand how to help patients that are higher BMI, but also maintain a super high level of safety and also a super high level of results. And we just took the last 18 years and we just incrementally improved on that process. And lo and behold, here we are. Obviously, we pioneered plus size tummy tuck, registered, trademarked it, and we did a bunch of other types of procedures and publications, so body contouring procedures. We looked at our data from 2019 to 2024, so that's 5 years. No DVT, no PE, no deaths. Obviously, we've never had a death in the whole time that I've been in practice. No large wound necrosis that required debridement and surgery and all that stuff. Basically seamless type of healing. Yes, there were little ditzels here and there, but they just basically took care of themselves. So I think we've accomplished our goal over the last 18 years. We can do high BMI patients. Our highest BMI today has been 88. We can do so safely. Look at this 5-year data protocols. And then, of course, if you just look at our Instagrams and our photo gallery, you can see that our results are, I think, great. And so now we have great safety, great results, great consistency for very high BMI patients and normal BMI patients as well.
In the case of a fleur-de-lis tummy tuck, is it possible to put the incisions on your sides versus in the middle?
That's called a torsoplasty. That has been done. I don't recommend it for a couple of different reasons. The first is that if you think about it, you're getting 2 incisions versus 1. Second is you're working against nature versus with nature. The body, as there's aging and as with gravity and with, let's say, plank position, where does the loose skin want to go? Right in the center, right? When you do a plank, the loose skin gets accrued in the center. As we age, that's what happens. As we sit down, that's what happens. And so by pulling away from the center, you're kind of working against nature and as opposed to with it. So for those 2 reasons. Now, you don't have to take my word for it. There's actually been work done at this in the past, maybe about 10, 12 years ago, that started to become a little bit of a trend, torsoplasty with the incisions on the side. And that didn't make any sense to me, so I didn't do it. And then 2, 3 years later, everyone abandoned it because they saw that, hey, it looked great for a few months, but then a year or 2 down the road, that wasn't the right idea. So the short answer is don't do it. Just do the vertical incision. The long answer is everything we just talked about.
Last question, how do I get a consultation with you?
Sure. Well, you can message us here on Instagram. We're also on TikTok. But you have 2 websites, drrepta.com, plussizetummytuck.com. You can do a virtual consultation at the top. But if you want to give us a call, our phone number is 855-377-3782. Thanks, guys. Until next time.